It could be weeks before we find out what caused a 54-year-old man in the Travis County Jail to collapse and die last week. Benjamin McGuire is the first inmate to pass away in the Travis County Jail this year, and as authorities await autopsy results, the KVUE Defenders discover that the inmate was found to be mentally incompetent and ordered to a mental health facility 2 weeks before his death. So why didn't he go? Here's investigative reporter Jenny Lee.
Benjamin McGuire was in the Travis County Jail, accused of repeatedly kicking a 73-year-old man in a wheelchair. It happened at Zoe's place back in April, a group home near 46th Street in Central Austin. The assault with injury to an elderly person charge is a third-degree felony, carrying a punishment of 2 to 10 years in prison. But nearly a month later, McGuire was deemed mentally incompetent, so he couldn't stand trial. A judge ordered him to a mental health facility. He never went. According to the Travis County Sheriff's Office, there are 162 inmates on the wait list for a state psychiatric bed. That's where they receive competency restoration services. But due to privacy issues, a spokesperson could not confirm if McGuire was on that list. In Texas, generally speaking, if someone faces aggravated charges for harming a person and is deemed incompetent to stand trial, they could be placed on that wait list. The KVUE Defenders have been tracking the wait list for state hospital beds. It went from a high of 2,571 in December of 2022 down to 1,687 as of June. That's according to the Texas Health and Human Services Commission. An agency spokesperson lists several reasons behind the drop: the opening of new state hospitals, the development of new programs like the forensic support team, and filling more than 1,500 full-time positions at state hospitals. The state hospital retention rate jumped from around 62% in fiscal year 2021 and 2022 to nearly 87% in March. Now, we won't know the cause of death for several more weeks, but according to the state custodial death report, McGuire had a pre-existing medical condition. He exhibited mental health problems and made suicidal statements. The report also shows that on the day McGuire died, he had just received his evening meal before collapsing. Jail staff found him unresponsive and performed CPR with no success. An investigation into McGuire's death is underway, which is standard. A final autopsy report is pending.